1917, Alan L. Hart became one of the first trans men to undergo hysterectomy and gonadectomy as treatment to what is now known as gender dysphoria. In 1948, biologist and sex researcher Alfred Kinsey published Sexual Behavior in the Human Male that concluded homosexual behavior is not restricted to people who identify as being homosexual. 4 years later, the American Psychiatric Association listed homosexuality as a sociopathic personality disturbance in its list of mental disorders. This was criticized due to the lack of empirical and scientific data. It would take the APA more than 20 years to change this distinction. Christine Jorgensen became the first American to undergo gender-affirming surgery in 1952. June 1981, the Centers for Disease Control and Prevention reported the first cases of what would later be known as AIDS, the first cases in the U.S. of the deadly disease decimating the gay community. 4 years later, actor Rock Hudson died of AIDS-related causes, one of many lost in the arts community. Although AIDS was first reported in 1981, it was not until the end of his presidency that Ronald Reagan spoke publicly about the epidemic. On December 1, 1988, the World Health Organization organized the first World AIDS Day to raise awareness about the disease. In August 1990, President George H.W. Bush signed the Ryan White Care Act, a federally funded program for people living with AIDS. Ryan White was an Indiana teenager who contracted AIDS in 1983 through a tainted hemophilia treatment. The AIDS cocktail was introduced in 1995, which dramatically improved the lives of people living with HIV. In 2012, the Food and Drug Administration approved Truvada as a daily preventative for those at risk of acquiring HIV. That same year, the APA removed gender identity disorder from its list of mental disorders. It replaced it with the diagnosis gender dysphoria. This led to a 2014 ruling that Medicare must cover surgery for gender transition. In May 2023, the Food and Drug Administration officially eliminated most restrictions that have prohibited gay and bisexual men from making blood donations. These restrictions on donating blood dated back to the early days of the AIDS pandemic. In the 21st century, LGBTQ plus healthcare has become more widely normalized. However, a lot of protections for transgender students have been rolled back.